Okay, so today we're diving into one of healthcare's really persistent, maybe most infuriating bottlenecks. We're talking about the administrative nightmare, the ones surrounding eligibility checks, claim rejections, and, well, delayed revenue. And this isn't just about slow paperwork. It feels like this constant preventable friction that just drains the financial health of providers pretty much across the board.
It really is. It's almost the definition of inefficiency, isn't it? We're talking eligibility errors that directly translate into denial rates hitting 10%, maybe 15%, sometimes, believe it or not, even higher for practices that haven't quite updated their systems yet.
Wow, that high.
Yeah. And the core challenge, well, it's simple on the surface. These administrative slip-ups, they just slow down the whole engine of revenue collection, and they seriously erode profitability.
And what the sources we looked at show is that the root cause, it often feels completely, almost ridiculous in today's high-tech healthcare world. I mean,
Right.
we're talking about critical mistakes that are fundamentally tiny.
It's exactly right. You'd think by, 2025, with all the sophisticated EHRs and advanced billing software out there, we'd have moved past these really basic errors.
Yeah.
But the sources, they confirm it again and again. These are often just clerical mistakes, like a typo in a patient's address, maybe a missed digit in an ID number, an outdated insurance policy that expired last month, but, it just wasn't flagged at check-in.
Simple oversights.
Simple oversights, manual entry errors, or sometimes, and this is critical, a failure in system interoperability. The provider's system just not talking correctly to the payer system.
It's honestly astonishing that a simple administrative lapse, like the wrong date of birth, punched in by a staff member who's probably under pressure, can still kick off this massive financial downstream mess.
Oh, absolutely.
Yeah.
That small lapse, that's the broken link in the chain. So when that claim eventually hits the payer system, bang, it's instantly rejected. And that rejection, look, it doesn't just mean a delayed payment. It means the practice now has to spend valuable, expensive staff hours chasing down that single error.
How expensive are we talking?
Well, estimates suggest reworking just one denied claim can cost a practice anywhere from, say, $25 up to $100. That's just in administrative labor. Now, multiply that across hundreds or thousands of claims, that cost adds up exponentially. It's huge.
Okay. If that's the reality, then our mission today for you listening has to be understanding the absolute necessity of modern eligibility verification. It's clearly not optional anymore, is it? It's like an essential barrier. It provides financial stability, and maybe just as importantly, it really transforms the relationship with the patient. Okay, let's unpack the fallout here a bit more. If a practice skips this really crucial pre-service check, or maybe does it poorly, the consequences seem to just ripple out significantly. What are the operational landmines that providers are stepping on when they treat eligibility verification like just another optional chore?
Right, the operational pain is immediate and, frankly, quite severe. Beyond those rising denial rates we just talked about, the major cost is really the time wasted on claim rework. You've got staff who aren't performing value-added tasks. Instead, they're forced into this, endless cycle of appeals, corrections, and resubmissions.
It's reactive.
Completely reactive. And it often means practices have to hire more billing staff just to manage mistakes that were actually preventable in the first place.
So we're basically talking about an entire department operating reactively, like they're just trying to plug leaks in the ship rather
Yeah.
than actually sailing forward.
Precisely. That's a good way to put it. And then there's cash flow. Cash flow is the lifeblood of any practice, right? These interruptions can be severe. Think about it. If 15% of your claims are tied up in rework for, say, 30 to 60 days,
That's huge.
that is 15% of your expected monthly revenue effectively held hostage by administrative errors. And that delay, it affects everything. It impacts payroll, purchasing necessary equipment, planning, everything.
And then flipping it around from the patient perspective, this is perhaps the most visible and emotionally charged consequence. This administrative failure, it leads directly to that thing everyone dreads, the surprise bill.
Absolutely. The surprise bill is the ultimate trust breaker, isn't it? The patient shows up, they receive care, they expect their insurance coverage to work as planned. But if that verification step was skipped, or maybe just done poorly, months later they get hit with this colossal bill. Why? Because maybe their deductible hadn't been met yet, or perhaps the specific service wasn't actually covered under their particular plan. And that's a detail that really should have been clarified before the service.
Yeah.
That unexpected financial burden, it causes anger, confusion, and it can absolutely lead the patient to question the provider's integrity. They feel misled.
I read one source that described a patient who actually delayed necessary follow-up orthopedic care for 6 months simply because of A $300 unexpected copay balance from a previous visit that hadn't been properly estimated beforehand. So it's not just about the money, it's genuinely about access to care, too.
That's exactly it. That's the human cost right there. And that's why we really have to clearly define the solution here. Eligibility verification is the absolute cornerstone of, let's call it, financial cleanliness in a practice. And look, it's not just confirming they have an insurance card. It means confirming 4 specific, crucial data points before they even walk into the exam room.
Okay, can you walk us through those 4 points and maybe specifically connect them to how missing one could lead to that denial we've been talking about?
Certainly. So first is coverage status. A simple question. Is the policy active today, right now? If it's expired, denial. Second, the copay. What's the fixed fee they owe at the time of service? Knowing this helps collection up front. Third, the deductible. This is key. How much does the patient still owe out of pocket before their insurance actually starts paying? And crucially, how much of that deductible has already been met this year? And fourth, benefit limits. Is this specific procedure or service actually covered under their plan? Or maybe, is it considered medically necessary by the payer? Does it need prior authorization?
Okay, so missing any one of those could trip things up.
Absolutely.
Yeah.
Missing anyone can trigger a denial or, at the very least, that unexpected patient bill later. For instance, knowing the remaining deductible up front is huge. It prevents the patient from suddenly facing a $500 bill they just didn't anticipate. And that kind of surprise is often the main reason for non-payment after the service has already been rendered.
Right. Okay, so if that complex 4-point check is really the key here, then the only way to execute it reliably and quickly enough seems to be finding more speed and accuracy, which brings us directly to the technology that's powering this shift. And here's where it gets really interesting, I think, because the standard for doing that verification is changing, fundamentally changing.
Yeah.
It's moving away from being this manual, reactive chore into something that's instantaneous, proactive, really an advantage.
That's right. The term you'll hear is real-time eligibility verification. And it's a necessary evolution away from the old way of doing things. Think back to how it used to be, maybe still is in some places. Staff would manually call payers, wait on hold, or maybe run batch eligibility checks overnight.
Yeah, the batch check.
Right. And that only provided static basic data for maybe 24 hours prior.
Yeah.
If the patient called their insurance company and made a change that very morning, the system missed it completely. Denial waiting to happen.
So how does the new approach, the new tech stack, achieve this real-time dynamic accuracy? What's under the hood?
Well, the shift is pretty much entirely powered by integration and smart processing. First, you have automation. This handles the actual communication with the payer, getting rid of the need for phone calls and manual keystrokes. This is done through advanced application programming interfaces APIs. Basically, they allow the provider system to talk directly and instantly to the payer system.
Okay, direct line.
Direct line. Second, we integrate artificial intelligence, AI, and advanced analytics into the process.
Let's pause on the AI for a sec because that can sound like just a buzzword sometimes. How does AI actually help prevent a claim rejection that might start as, say, a simple human typo at the front desk?
That's a fair question. It's really about pattern recognition, leveraging huge amounts of historical data.
So when the system pulls the real-time patient data via that API, the AI instantaneously cross-references it. It looks at millions of past claims from that specific payer or even for that specific insurance product the patient has. It spots patterns. Like it might know, okay, payer X almost always denies service code Y if the patient's policy type is Z unless there's specific documentation attached. The AI can flag that potential discrepancy before the service is even rendered. It prompts the staff member right then and there. Hey, check for missing documentation, or does this need prior authorization? It's not just checking for basic coverage anymore. It's genuinely predictive denial avoidance.
So the AI is acting like a really sophisticated early warning system. It's saying essentially, hold on, based on historical behavior, this exact claim setup has like a 90% chance of being rejected by this specific payer unless you check X, Y, or Z. Exactly. That's precisely the value. And then the crucial third element is deep electronic health record, EHR integration. This whole real-time verification system, it absolutely must live within the existing clinical workflow. If staff have to log into a separate portal, open another window, copy-paste info, the process breaks down. It's too cumbersome, and they'll just resort back to the old, less reliable manual checks.
Yeah.
True success means the check happens automatically, seamlessly, as part of the normal scheduling or check-in process.
Makes sense. So what are the immediate sort of tangible results for providers who actually manage to deploy these modern automated tools successfully? What do they see first?
The results are measurable and often
If you are looking for outsourcing services, schedule a demo